Hello, Essential Therapy followers. Dr. Cindy here, and I am at the beach. So definitely not in Northwest Ohio today, but I thought I would do an essential chat here at this beautiful setting, and I meant to do it earlier today before there were a bunch of people, so we'll just see how this works out. And I also thought I could do this without my sunglasses, but I don't think that I can, so I hope you're okay with that. What I wanted to talk to you about today was something that has come up for many years, and I routinely find myself having this conversation with especially new patients, and it's happened a lot over the last month. So I'm going to discuss what this whole process is sometimes like when you start to get myofascial release. And let's say someone comes to me and they have a hip pain or a back pain. Let's just start with the hip. Let's say that it's their left hip, and their left hip has been bothering them for whatever period of time, whether it's a few months or a number of years off and on, or it's been many years off and on, and they've just kind of worked through it. Oftentimes, what I see with new patients especially is someone who's had a lot of myofascial restriction over many years, and maybe they've even had other treatments, or they've had procedures like even surgery or multiple surgeries, and nothing has really fully worked. Or maybe it took care of the pain that they had at that point in time. Maybe they had back surgery and that took care of the back pain, and now their nerve pain is gone, but then over the next year or so they developed this other pain. Could have been a neck pain or a hip pain, and then maybe even a few years down the road from that they ended up having a procedure for that. Now they've had neck surgery. I can't tell you how many patients I've seen over the years who've had this type of scenario go on. And maybe they got through that, or it's like never really got perfect, but it was better than it was. And the doctors are kind of like, well, look, that's what we did. That's all we have to do, You just have to make the best of it. And then, a little later on, they're starting to have a hip pain. Or maybe it's a foot pain. It could be anywhere in the body because everything is connected. So what happens then when I see that patient, typically there's such a vast amount of restriction in their body. So I'm not talking about like just a restricted shoulder or restricted hip. Like, it doesn't work that way, right? It's the whole body. So when we do something to our body, it affects not only that area, it affects everything. And this is one of the biggest problems I feel with traditional medicine is that, even insurance, we're using diagnosis codes, and so you're treating a certain area of the body. And when I worked in a hospital setting, you had to have the prescription from the physician. If it said shoulder, you better be treating the shoulder. Of course, in my training, I would be very creative if I needed to say, hey, well, I need to treat the pelvis because the pelvis is affecting the alignment of the shoulder, etc. But this is how we as myofascial therapists look at everything. We look at the whole body. That's why we look at you in standing when we see you for that day, because you could look different today than you did last week. And what we're looking for are these tensions that are pulling throughout the whole body. So when I see someone who's coming in for particular pain, and we start to address that, I am not just feeling that area. I am aware of the tightness in the whole body, and so many times it's just a severe restriction everywhere from head to toe. So when I pull into that body, I love to use this example of the tablecloth on the table. And so imagine a table, and there's a tablecloth on it, and so in the far right corner there's a stack of plates. Well, even if your eyes are closed or you're blindfolded, if you were tugging on that tablecloth, you'd be able to tell that there's something over there in the far right corner. You might not know it's a stack of plates, but you'd have an idea about how heavy it is. Then if somebody, changes that stack of plates and puts a big heavy box of, let's say gold bars in the box on the table, and you go to tug on that tablecloth, the same tablecloth again, you're going to tell a difference, right? You can feel that there's much more restriction, something's much heavier that second time around. Well, as we are pulling through your legs or any other area of your body, for example, your body is kind of like that tablecloth, and your restrictions are kind of like stacks of plates or boxes of gold bars or whatever the case may be. And sometimes it feels like they're everywhere. So many times when I go to pull on someone's legs and it's a new patient who's had lots of restrictions over the years, maybe they haven't had a lot of pain because they're just not aware of it, or they're not feeling it in that way. But I could feel that body and there's a level of restriction that I think of as severe, like severe total body restriction to me feels like that tablecloth has boxes laying all over it, okay? And so as we begin to unravel this situation, it's kind of like the way I like to think about it, or start to take those boxes off of the tablecloth, it's not just a simple linear process. It's not like from point A to point B, it's a straight line. It's not like that. It's an unraveling, and the body, because of the tensegrity structure that the fascial system is something that we can't even predict necessarily. Each body is different because each body has had its own history of things that have created dehydration in the tissue. The fascia of course, needs to be very hydrated. The body needs to be very hydrated, but you can be drinking all the water in the world, and if your structure, if your fascia is restricted, that fluid isn't going to get in where it needs to go. That's why you need a therapist who's trained in this type of technique and has the skill to be able to soften that tissue manually, because sometimes we can't do it ourselves. I'm big on self-treatment, and I treat myself every day, but there are sometimes things that I can't get to myself, and the patient can't get to themselves either. So when there's severe restriction in a body like this, and someone who's had difficulties at different times over their life, this just starts to layer upon layer upon layer. It kind of reminds me of, and I can think of several analogies, some are kind of silly, but I love the example of the necklaces being all in a bundle, right? They're all like in a heap, and they've all got tangled. And as you go to unravel this mess, or even think of rope, okay, string, anything like that, it's a process. It's not just, sometimes it can get so frustrating that you need to put it down for a while and come back to it, if you know what I mean. But you may be thinking of this particular necklace that's in this heap. That's the one you want, but you can't just always get just that one. You have to go through this mess and unravel it as you're able. And sometimes it actually looks worse for a while, and it's like, oh man, what did I get into? This is not working. But if you keep at it, you're able to continue that process until everything is unraveled. The other thing that I would experience a lot is if I used to have a Jeep, or even in a motorcycle, if you're riding and going fast, especially, and you have hair like this and it's not bundled up, it gets in a huge tangled up mess, right? So it's not like an easy process just to comb that out. It's you start at the ends and you gradually move up. You might have to use some product in your hair, that kind of thing. So over the years, that's kind of how I look at it. These fascial restrictions can get stronger and more complicated, and they start involving more parts of the body, because the body is so smart. If you injure an area, it's going to do what it can, especially if there's pain there, it's going to do what it can to shift the body and to create tightness in other areas and hypermobility or looseness in other areas to take that strain off in the space that's hurting. So that may work for a while. Then, fast forward however long, it just is going to depend. Now that adaptation the body made may start creating discomfort in another area of the body. So now instead of having left hip pain, now you got back pain. Or maybe you started having this nagging shoulder thing pop up. Or maybe you're starting to get plantar fasciitis in your right foot. The possibilities are endless. So as you start to get treatment, and let's say your left hip pain starts to ease up a bit, but now you're feeling it somewhere else. That can be very frustrating, because especially for people who aren't really sure about myofascial release yet, it's like, maybe this will help. You've tried everything, but you don't really know, and so it can be very discouraging. And I just want to encourage you at this point to stick with it, because this is about removing those heavy boxes on the tablecloth in a way that's going to help you have freedom in your body. And so if you get frustrated and let go of this process, you're not going to reap the benefits of the amazing benefits that could be there for you, which is mobility and decreased pain and just a life of getting movement back and getting activities back that maybe you had to let go of before. So that being said, I just want to encourage you that if this is a new process for you, remember that it didn't happen overnight. Your pain did not happen, typically from just one event. Even if you had an accident, let's say, that made things much worse, there was an underlying level of restriction there, most likely. So as we gradually unravel things, it's going to be a process. You may have some discomfort here or there. That's the body talking to us. Tell the therapist this. We can kind of watch the body this way and feel what's going on and help address those areas that are popping up. But we're going to be working on areas that aren't painful necessarily to you right now too. So we have the saying, find the symptom, look elsewhere for the cause. So may be having pain here, but your cause may be lower in the body or vice versa. So it's really about trusting this process, and it helps to hear stories from other people who've had success. So I'm encouraging some of my patients who've had success to give us some reviews and to help people who are just starting this journey. And the other thing that is so important, we can only have our hands on you for so much time. So self-care is something you must do every day and learn about the process. And sometimes people are pushing too hard in self-care. So we need to readdress that and say, hey, don't push into pain. Some people don't really know where that level is, and we have to teach them this. And that's easy enough to do. It just takes some awareness. So think about your home treatment. Are you getting your home treatment in? Are you maybe pushing too hard in your home treatment? Are you maybe not doing the right thing? Maybe we need to together work on that and reevaluate what that is. The other thing is, when people are extremely, extremely tight and throughout their body, their fascia is really restricted, it's actually best if we can have more visits at the beginning, because people always say, well, it's just going to stay. The truth is, in my experience, sometimes we get 2 steps forward and 1 step back when the restrictions have been there so long. The body's patterns, it's just used to being in that space. So there's also some neuromuscular re-education that needs to change. The neurological system, it kind of needs to be reset. And if we can really work hard on having hands on the body, releasing this restriction and not giving it a lot of time to go back into that pattern, especially if some of your restrictions are from activities that you're doing on a regular basis. So if part of why you have all this restriction is because of your job, and you're getting 1 hour treatment and then you're going to work for 80 or 100 hours before getting treated again, it's going to be harder to break through that restriction. Does that make sense? So we've often done mini intensives or intensives. Years ago, I used to do a lot of intensive treatment where people would come from out of town and get treated for 4 hours a day for 5 days in a row. And that's obviously very intense, and it doesn't have to be that intense, but having more visits closer together, like coming for a few times a week in a short period of time, even if you can't have just the one therapist. Now my schedule gets really busy, but we've been able to do that and incorporate mini intensives for people who need that type of work. So just wanted to give you some thoughts on the process of first getting myofascial release, especially for those who are very restricted and dealing with pain, and then becoming frustrated that other areas of the body are now speaking to them and they weren't before. Don't be discouraged. This is actually a really good sign, because the body is changing, and that is what we need. We need to unravel that mess of tangled rope, or whatever you want to think of it. And it's an amazing system that is in the body. It's very wise, really. We just have to learn to work with it. And one of the ways to work with it is to be consistent, get a lot of treatment initially if you need it, and stick with the process. Because most people, by that time, what has really helped? A lot of times your only option then from the physician is to just get another surgery or to get a surgery. And many patients of mine over the years have been able to avoid that process of having to get, go under the knife again or for the first time. Not saying that always works. Sometimes we need it, but even if you need it, myofascial release is so important to keep the body fluid and soft and functioning so that all of the system works together well. This was much longer than I planned, but I hope it helped. Have a great day.